this is one of the common situations that you may see during the practice. You need to uh, keep in your mind that the patient has the autonomy. They have the right to decide about their care, whether or not they want to continue with the management proposed by the doctor. In this particular situation, this patient is coming with the signs of pneumonia and is has been diagnosed with the pneumonia. Your consultant has advised to start the IV antibiotic, which is the best treatment for this patient. So to continue with the IV antibiotics, the patient needs to be within the hospital so that uh, patient's recovery can be monitored. In that situation, we need to go and explore the patient, just explain everything about that. Before we go, before we start talking about explaining, we simply go introduce ourselves to the patient, check the identity, check the age, and then explore how they are feeling about their health. Are they improving or not? And how the patient has come to the hospital. That's also very important that we ask a bit about the history and about the signs and symptoms they presented with. Then we want to know about the patient's own understanding. You can simply ask by saying, this patient, Mr. Arthur, do you know what is happening and why you are in the hospital? What's the diagnosis, and do you know about the plan? Uh, Check if the patient knows or not. If the patient does not know, uh, tell them, and if the patient knows, then acknowledge their understanding. Then move forward, ask them what do they think about the management plan that your team has proposed, which is essentially in this case is starting the IV antibiotics and keeping the patient within the hospital for some time. And the time is uncertain. It depends again on the level and the speed of the recovery of this patient. So if the patient recovers very well quickly, then the patient would go home quicker. And if the patient shows slow recovery, then it may be a kind of prolonged hospitalization. However, the benefit of staying in the hospital is that we want to explain to this patient is treat the infection quicker with the IV antibiotics. We can monitor your bloods. We can monitor your lungs by doing the x-rays again and again if needed. And we will be able to change the antibiotic if they are not working. And we will be able to control and get on the top of the infection. We need to explain that if the infection spreads out and goes into the blood, it can cause severe shock. You may lose a consciousness, you may become drowsy, you may become confused. All those things are mandatory for the patient to understand and for us to explain to the patient. The other benefit is that we can start the treatment for any additional symptom that the patient would get during this hospitalization. And we will be able to support if they need any help in eating, in drinking, in walking, and in the mobility. Any kind of help will be readily available. So these are the important things. If not continuing with the treatment, as I mentioned, the potential complications are worsening of the infection, becoming septicemia, becoming shocked. Patient may need sometimes going on to the ITU if the treatment fails. However, if the patient insists on going, we need to explore what are the blockers, why the patient does not want to stay in the hospital. We need to assess a patient's mental capacity. If the patient has the capacity, we need to find out if there's anything that you can offer in terms of help. Sometimes you may see the patients may be worried about their family relative who is unwell. You may see a patient worried about about his wife or husband because they are terminally ill, and this patient wants to go because he is the main carer. So we need to look into all those reasons, as well as if you do not find any particular reason, sometimes we may need to think about the mental health issues. If the patient is not able to give you the proper reason that makes sense to you, always think about whether or not the patient is suicidal. The patient may be so depressed, the patient may just want to commit a suicide and end life. Uh, Patient may be bothered about not seeing any good recovery. In this particular case, you can see the patient had the cabbage, and now the patient have developed heart failure as well. So, which is a clear decline from a normal life to towards bit more dependent on the medications and limited mobility, shortness of breath. So, if we imagine all those symptoms, uh, it is not very good quality of life. So, it may be the reason of the patient's decision. So, in that situation, we may offer them psychological support, we may offer them mental health support, we may get them to come and speak to the patient and see the patient. And sometimes you may be finding it difficult because you are a junior doctor. So always try to think about, is anyone else who can help with the situation, and who can come and explain, and also give the chance to the patient, also ask him whether or not he wants to discuss with their next of kin, and just explain what we are willing for him to do, and also ask them if they want you to speak to their next of kin or any friend or family who they feel will be helpful. So we need to explore all those things. Sometimes you may see the patients are worried about their workplace. Sometimes they may be worried about an interview. So all those things we need to find out. If you think that we can be helpful, offer them all sorts of help so that we can facilitate them getting the treatment which is good for them. And if the patient does not want to stay, despite all efforts, despite all the explanations, and despite them knowing the potential complications, then the patient has a right to go home. But do not be rude. Do not take the charge of the patient. Patient have their own rights to carry on with the treatment or to refuse the treatment. We need to make the clear documentation. You can try to get one of your colleague along with you when you talk to such patients, and make sure that you write all the documentation clearly so that it becomes an evidence for you in future if needed. And if the patient uh, decides to leave the hospital, you need to get them sign the self-discharge form, and always advise them the red flags, always advise them what to do when they become unwell. And another good thing that you may do is explore if the patient has any sport at home. Ask them who do they live with, um, and is any sport, is any carer who comes to the patient, because it may change the patient's mind if you explain someone who is living alone going home against medical advice, where you have suggested them to carry on with the antibiotics because they may become unwell. They may not have the idea that it can cause a confusion, and what they will do if they become confused and they are alone. So in that situation, he may not be able to come back. So explain that because of your circumstances, as you are living alone, I must tell you that this infection can cause a drowsiness, can knock you off the consciousness, and in that case, even if you wanted to come back, you may not be able to, because there may not be someone to inform the hospital to call the ambulance. So the situation may be very different. If you want to take all those risks, I totally respect your wish, and I'm happy to see you back whenever you want. If you change your mind, by all means, come back straight to the A&E so that we can continue your treatment from where you left.